Welcome to Roadmap to Residency, Evidence-Based Applications. We are starting our microbiology module. And in this video, we will be dealing with some questions to only give you a brief idea about what to expect in microbiology questions and how our future modules gonna be designed like. So hello everyone, I am Aviraz and welcome to our Club 250 Matchmaker sessions. So here we have the first question with us. So these patients most likely developed infection from which of the following bacteria? And epidemiological studies conducted after a sudden increase in the rate of severe post-operative infections in a rural hospital. It is determined that all the patients who developed the infection were operated on with surgical instruments sterilized by a specific autoclave machine. The machine was found to be inadequately sterilizing the equipment due to a malfunction limiting the temperature of 100 degrees Celsius during the 15-minute cycle. Now, these patients most likely develop infection from which of the following bacteria? Brucella, Clostridium perfringens, E. coli, Listeria monocytogenes, or Streptococcus pyogenes. Now, to answer this question, you need to have a brief idea about the different sort of sterilization techniques and all. So we will be discussing that in our further videos. But for the part of explanation for this video, so the autoclave machines are pressure cookers that use heated steam at temperatures of around 134 degrees Celsius to rapidly destroy the pathogenic bacteria, fungi, viruses, and spores. Lower temperatures are often associated with inadequate sterilization due to the presence of spore-forming bacteria, which can survive at temperature past the boiling point of water. Bacterial spores are often found in soil and water and are resistant to chemical disinfectants. Bacillus and Clostridium species are among the most common spore-forming pathogenic bacteria. So either Bacillus anthracis or Clostridium perfringens or Clostridium botulinum. So which of the following best describes the mechanism of action of the toxin specific to these bacteria? So a 25-year-old woman comes to the emergency department due to the 2 days of abdominal pain and bloody diarrhea. A few days ago, she attended a church barbecue. She does not know whether anyone else at the party developed similar symptoms. The patient lives alone and has no medical conditions. Temperature is 98.8, blood pressure is 119/76, pulse is 92, and respirations are 16. Now, there is abdominal tenderness with no rebounded guarding. Guaiac-positive bloody stools are detected on rectal examination. Stool cultures reveal E. coli strain that does not produce glucuronidase and does not ferment sorbitol on sorbitol containing McConkey agar. Consistent with serotype O157H7, which of the following best describes the mechanism of action of the toxin specific to these bacteria? Disruption of the cellular cytotoxin, inactivation of 60S ribosomal subunits, inactivation of elongation factor 2, inhibition of sodium reabsorption, or stimulation of chloride secretion. Now, to answer this question, you need to have a very good knowledge about the different bacteria and the toxins that are produced by these sort of bacteria. Don't worry, we will be dealing with those parts in the future videos. This video is only to give you an overview and idea about what to expect to learn in microbiology. So E. coli virulence factors are lipopolysaccharide, K1 capsular polysaccharide, cicatoxin, heat stable or heat level enterotoxins, and P. fibrae. And let's only focus on this, that is cicatoxin, that is it inactivates the 60S ribosomal subunit, halting the protein synthesis and causing cell death. And that's how the patient has a presentation of gastroenteritis, just like our patient, which is generally presenting with a bloody diarrhea. We have one more question here. Now, this pathogen most likely demonstrates which of the following characteristics. A 52-year-old man is hospitalized due to the 2 weeks of low-grade fever, malaise, anorexia, and fatigue. The patient has a history of bicuspid aortic valve and underwent aortic valve replacement a year ago. Physical examination reveals a new regurgitation murmur, and blood cultures repeatedly show a gram-positive cocaine clusters, which are identified as staph epidermidis. Now, this pathogen most likely demonstrates which of the following characteristics: alpha hemolysis, mannitol fermentation, negative catalase test, negative coagulase test, novobiosin resistance, or yellow pigment production. Now, the thing is that in microbiology, you need to remember the shape of the bacteria. You need to remember the specific characteristics of the bacteria. You need to remember the clinical diseases the bacteria causes. And also you need to remember the different sort of medications that we give for these organisms, right? So Staph epidermidis is a low virulence skin commensal that rarely causes infection in healthy patients. However, those with prosthetic devices are at risk because the pathogen produces adhesion and biofilm protein that allow it to grow on artificial surfaces. Staph epidermidis is one of the most common contaminants of blood cultures, but infection should be suspected when multiple blood cultures grow the bacteria and or the patient has symptoms of clinical infections such as fever, malaise, and leukocytosis. Staphyp species are gram-positive cocci that grow in grape-like clusters that are differentiated from streptococci by the catalase test. Streptococci are catalase negative, whereas staphylococci are catalase positive. Now, further speciation of staphylococci leverages the coagulase test, which is the ability to clot the blood plasma, which differentiates the staph aureus from coagulase negative staph, such as staph epidermidis. Now, this is the basic structure. We can see gram-positive cocci in clusters. Thank you for watching. Keep studying out.